The Texas A&M AgriLife Extension Service has been dedicated to educating Texans for over a century. In 1915, the Extension Program was established under the federal Smith-Lever Act to deliver university knowledge and agricultural research findings directly to the people. Ever since, AgriLife Extension programs have addressed the emerging issues of the day, serving diverse populations across the state. Texans turn to Extension for solutions in horticulture, agriculture, 4-H and youth, and family and consumer sciences. Extension agents respond not only with answers, but also with resources and services that result in significant returns on investment to boost the economy. Join us Fridays at 1 o'clock for the AgriLife Extension Hour. Today on the AgriLife Extension Hour, we will be featuring family health and wellness with host Amy Ressler.
And good afternoon. This is Amy Ressler, County Extension Agent for Family and Consumer Sciences with Texas A&M AgriLife Extension Service. And I'm just really excited to be back here in the studio with the Extension Hour. And I've got a very special guest with me today. I have Mrs. Marilyn Kasmeirsky, and Marilyn is the Director of Professional and Government Relations for Lone Star Family Health Center. That's a big title, Marilyn.
It is a big title, and thank you so much for having me. I'm really excited to be here today and share in the AgriLife Extension's Health Hour.
Yeah, we're glad to have you. So this is the Extension Hour, and we do family health and wellness, and we've talked about a lot of different topics in our segment, and we don't talk just a whole lot about specifically about health. And I was thinking about what are we going to do for this, for the program today, and it is the family health and wellness, and we don't talk just a whole lot about specific health. But then I started looking for topics, and health is a very broad topic. I mean, there are so many things when you think about health and what that means and what that entails. Of course, the first thing I always think about is food, because we do a lot of food nutrition and food. There's a lot of health conditions that are directly related to food, but there are a lot that have more to do with lifestyle and that kind of thing. And the health center is just a great resource that we have here in this community. What I love about the health center is that it really has something for everybody.
Absolutely. We serve families from birth to end of life. We have women's health services, we have OB-GYNs, we have family medicine doctors, we have dental, mental health. So we really have the holistic approach to taking care of a family. We want to try to have that continuity of care so families do have a health home and know where to go to maintain the healthiest they possibly can be and provide those resources. I know the AgriLife Extension has been very instrumental in one of the collaborations that we do in our partnership and has helped us with back to basics cooking in our teaching kitchen, which has been very helpful to our patients, and among other things. We always try to look at ways that we can include you even in our health fairs during National Community Health Center Week and our child seat safety and just anything we can do to have healthy families. February is kind of the month of love, so it's kind of like let's love our bodies and make sure that everybody remembers to get their checkups and take care of themselves. So that's very, very important. I know a lot of times we get very busy and moms especially forget to take care of themselves because they're taking care of everyone else.
Most definitely. And if you don't take care of yourself, you can't take care of others. I heard an analogy that I really like. It's kind of like a glass of water. You can't continue to pour when it's empty. So it's important that you refill your own glass of water and take care of your own health as well. Another thing, so the health center also has a full range of services in terms of ability to pay.
Absolutely. We take care of you of where you are in this moment of your life, whether it's commercial insurance, you're on Medicaid, Medicare, sliding fee, or even self-pay. And so we want to make sure that people don't think, I can't go because they associate health care and wellness with costing a lot of money. And at Lone Star Family Health Center, we make sure that we'll take care of you of where you are at this moment with the resources. We also have different grants and different programs that if people qualify for, that they can utilize those services for extended care. Some of the screenings that we have, for an example, the free mammogram screenings that we have, or free well woman screenings that we have with different funding sources.
Yeah, and I think that is so important because lots of times people will put off going to the doctor, going to get checked out because they're worried about the cost, or will my insurance cover it? Will it not cover it? Will it? all those kinds of things. And I love what you just said, at this point in your life, because last year I might have had a great insurance plan, but this year I may not.
Exactly.
So it's good to know that there is that resource and a place to go. Now, I've only been here in Montgomery County for about 3 years now. And you were one of the first people that I was introduced to, and I just often tell people when they're talking about, where do I go for a doctor? The Lone Star Family Health Center is awesome. They've just got so many great things, and they're very welcoming. It's a beautiful building. You've got great staff. You guys are also you do residency, right?
Yes, we are a teaching health center. We have Conroe Family Medicine residency program. So we recruit for the best of the best from the different health medical schools, and we have 10 residents that work in our clinic, and they actually do their full gamut of care at the hospital, and they get their clinical hours with us, which is amazing because that keeps us on our toes, keeps us up with the best of the best and the newest technology. We're not just stagnant in our learning and our ability. Since we are a teaching health center, we are staying up to date on the different healing processes and different diseases and ways to treat them. So we're very excited about having that opportunity that we can pass that off to our patients as well. Another thing that makes us unique, we have a Medicaid worker in our building. So if people have an unexpected pregnancy and need to be on pregnancy Medicaid, they can do it right there in the building. We have WIC in our building for nutrition. Sure. We have free pregnancy tests. We want healthy mommies and healthy babies. So we do that from 9 to 4. Monday through Friday, which is a big asset as well. And then we can get somebody plugged in immediately for their wellness so they do have a healthy baby and a healthy mommy. We also have case management. We have referral services. So, like I said, wherever you are in this moment of your life, we can really try to do the best that we can to help you and also have resources to direct you to.
Sure. You guys make it easy. I mean, as easy as it can be.
We try.
Obviously, it can be kind of complicated, but you guys really do have the resources to help guide people along. You also have a new dental clinic.
We do. We have general dentistry, and we also have pediatric dentistry. I know that the children love going. They're not afraid of the dentist. They do a great job at making the children want to come back. And, of course, there's the toy tower that, when they're so good, that they get to have the little coin to get the toy out of the toy tower.
Cool. No lollipops.
No lollipops, but our dental staff is amazing. They do a great job with all ages. We have adult as well as the pediatric dental.
Yeah. And then mental health services now as well.
We have mental health services. We have Jorge, who's from Chile, and he's our bilingual counselor, and we have Donald Kopnicki, who is also has a lot of letters and certifications behind his name to help families. We're seeing a lot of children. I think we were kind of surprised at the number of children, but a lot goes with mental health that people don't really realize. It's for families, it can be individual, and it can be group therapy. But even children that are bullied in school, they can come and talk to our counselors about that in a safe place and how to deal with that. And then there's elderly on the other end of the spectrum that maybe have dementia or they're depressed because I lost a loved one. Sure. So we try to take care of the whole family that way as well, even anxiety and OCD and different phobias or codependencies, even hoarding. I mean, I just thought that was kind of funny. But that is a disorder. And so substance abuse.
And all of those things can definitely affect our physical health as well. I don't think that they're two totally separate things, that you have mental health over here and physical health over there. Our mind and body are so interconnected that they definitely affect each other significantly, I think. So you mentioned hoarding, and one of the things about being healthy is having a healthy environment, and sometimes hoarding can not be a healthy environment. So there's when we talk about a little bit later some steps to keeping a healthy home. We want to talk about lots of different things related to health and being healthy, because that what impacts health the most is actually lifestyle has 50% of those things that affect. So genetics are about 21% of what affects our health. Environment is 19%, and then access is actually a 10%. So access means access to things like transportation being a problem, having the insurance that's needed. We're fortunate here in Montgomery County in the new bus system here in Conroe is a big deal. It drops people off. But, if you can't get to the doctor when you are sick, that will definitely affect your health if you can't get what you need.
One of the things we have done, we have satellite offices. Our main office is in Conroe, but we do have satellite offices in Spring and also in Willis. Mm-hmm. So our goal is to have access to care in the underserved populations around Montgomery County, so people do have access to care, because that will make not only healthier families but also a healthier community.
Sure. And so you are a great member of the community. You have a lot of connections with others, and certainly there are other healthcare facilities in the area. But, one of the things that I really also like about the Lone Star Family Health Clinic is, so I've gone to clinics before, to doctors' offices, and kind of felt like they were more interested in making money than really taking care of my health. And I've never felt that way at the health center. When I go to visit, when I'm there, as a patient, or even as, there to help with different programming, it seems to be that it's more about really taking care of people and their health. And I think that's awesome.
Well, we appreciate that. And when you do take care of everyone, you take care of the documented and the underserved population, as well as the insured and maybe the people that are uninsured. There's a lot of people that work that don't have insurance. A lot of people don't realize that. They associate people that are uninsured in a different category, but a lot of people do work that just simply can't afford their insurance. So since we do take care of everyone, we want people to walk in the door and feel respected. The doctors are there because they have a heart for caring for people and people from all different demographics and socioeconomic. So I appreciate you saying that, because, yes, we truly do care, and it is about the care of the patient and the care of a family.
Sure. Yeah, and so in Extension, what we do, we do education, and, our goal would be awesome if people took such great care of themselves that they never had to go to the doctor or the clinic, but we know that that's totally unrealistic, and so we do everything we can to educate people. And in the next few segments, I think we'll talk more about some health conditions and kind of things to think about, things to look at, and then so that like when you do need to go to the doctor, to the clinic. But we're going to take a quick break here this afternoon. We're listening to the Extension Hour on Lone Star Internet Radio.
You're listening to the Extension Hour with Texas A&M AgriLife Extension. Visit us online at montgomery.agrilife.org.
Doing business since 1985, Assistance League of Montgomery County is a nonprofit, all-volunteer organization where all proceeds stay in Montgomery County. We are proud to sponsor 10 philanthropic programs that enhance the lives of those in our community. Visit our thrift shop at 126 North San Jacinto Street in downtown Conroe, or call us at 936-760-1151. Don't forget to like us on Facebook.
Tune in to Chamber Chat with your hosts, Courtney Galley and Samantha Good, with the Conroe Lake Conroe Chamber of Commerce, every first Tuesday of the month at 11 a.m. I'm one of your hosts, Courtney Galley. Samantha and I will chat about the Conroe Chamber's upcoming events and programs for the month. Relax with a cup of joe or your favorite drink for Chamber Chat.
The East Texas Dream Center is in need of your help. We are a nonprofit Christian organization that houses women and children who are trying to get their lives back after being homeless, abused, or addicted. We are conveniently located at 301 South 1st Street, Conroe, Texas, 77301, right here in Montgomery County. Our needs are financial, and every needs of gasoline, cleaning supplies, laundry soap, Lysol, and whatever else God puts in your heart. To help our ladies and children, please consider a donation. You may visit our website at www.easttexasdreamcenter.org. Again, so you don't forget, it's www.easttexasdreamcenter.org. Donations are tax deductible. Remember what Jesus said, with God, nothing is impossible.
You're listening to the Extension Hour with Texas A&M AgriLife. Visit us online at montgomery.agrilife.org.
And we are back with the Family Health and Wellness Hour. I am Amy Ressler, County Extension Agent for Family and Consumer Sciences, and my guest today is Marilyn Kasmeirsky. She's the Director of Professional and Government Relations with Lone Star Family Health Center. So I'm so glad you're here today. We've been talking a lot about the health center, about the things that you can do, and we want to talk a little bit too about health conditions. So some common conditions that happen. So chronic diseases are those ones that's ongoing, right? No real cure for. So it's going to take a lot of treatment. And sometimes those are actually preventable. And we've got statistics that suggest that the top 3 or 4 chronic diseases that affect people: heart disease, cancer, diabetes, and arthritis.
That's right. And diabetes can be prevented. People can, through their diet and exercise and lifestyle, can prevent diabetes. And it can, if they take care of themselves, really get it under control. Actually, obesity is on the rise in Montgomery County and I think across America. So that's why education and what the AgriLife Extension does, and as far as Lone Star does, as far as prevention and education, is really to the benefit of the patient, to the community.
Right. I mean, definitely the more you know, the more you can help yourself. And I think preventing disease, we mentioned that before the break, definitely it would be great if no one ever had to go to the doctor, but we definitely comes up and we do. But heart disease. You were mentioning something about the connection between dental care and heart disease.
Absolutely.
Some people may not know that.
They don't realize that, but if you get gingivitis or your gums are not healthy, that bacteria gets in all of your bloodstream and goes through your heart, where your heart is the muscle that pumps through all the blood through your system, so infection can go throughout your system. And if you build up a lot of plaque on your teeth, then that also is building up plaque in your arteries and your heart. So that's very important to take care of your teeth. Keep that plaque off and stay healthy, because you don't want to have any kind of gum disease that's going to cause infection throughout your whole bloodstream. Right.
So prevention is a very important thing.
Absolutely.
And, besides just the discomfort of those diseases, it costs a lot.
Mm-hmm.
On average, the United States health expenses, they're like 2 times higher for someone who has a chronic condition and about 14 times higher for a person who has 5 or more chronic conditions. And so those things start kind of adding up, not only against your health, but definitely has a big impact on your pocketbook as well. Not to mention the time that you miss work.
That's exactly right. Education and prevention is very important. Preventative screenings, getting to the doctor regularly, doing your regular checkups. You might think it costs a lot, but it costs a whole lot more to be sick.
Oh, most definitely. Pay now, pay later.
That's right.
If you do not pay now, you will pay later. And people say that too about food nutrition. I eat the junk food now because it's less expensive. But and that could be debatable. We could do a whole discussion on comparing the price of food, healthy food versus unhealthy food. But definitely, if you are not taking care of yourself now, you'll be paying the medical bills down the road. And
even young people need to realize that. They need to take care of themselves now, because it will catch up to you at some point in your life. You think, oh, well, I'm young and I'm healthy and I'm going to be fine, but eventually it does catch up with you.
Yeah.
Lifestyle and habits.
And there's definitely ways that you can reduce risk. So cancer, for example, 67% of cancers could be avoided with lifestyle changes. So things like not using tobacco, regular physical activity, reduced safe sun exposure, normal weight, low alcohol consumption. All of those things can help us prevent. So it's 67%, those are pretty good odds.
Those are pretty good odds.
Yeah.
And if you have your preventative screenings, early detection is the best protection. So if you have your regular breast exam, mammograms and your regular colonoscopies, those diseases can be caught early and prevent you dying from cancer. So it's very, very important to have those screenings and have that prevention.
Definitely. And then with heart disease, you can prevent those also with lifestyle changes. Again, not using tobacco makes a big difference. Regular physical activity, what you eat, diet directly affects. And you identify your blood pressure and the blood lipid profile so that you identify those problems early. And then getting that medical help regularly. I think one of the things that happens a lot with folks who have heart disease or diabetes, for instance, think, oh, I've got it under control. I don't have to take my medicine. I don't have to go to the doctor because I'm feeling so much better. But it's really important to keep those regular visits and to follow those recommendations that the doctors make. And even with medications, sometimes it can cause problems. Sometimes it takes a while to find the right medications, but definitely following up with your doctor makes a big difference.
It's a big difference. And I think sometimes people just kind of accept the fact that that's what they have and they don't want to make an effort. They just, for 3 generations we've had diabetes in my family or heart disease in my family. But you don't have to accept that plight. You can be proactive in preventing that. That doesn't necessarily mean that has to be your plight as well.
I agree.
Be proactive.
Yeah.
People get kind of accept it, and we've got to change that mindset. Do some cultural changes as far as this is the way my grandmother had a can of Crisco in her pantry. We don't have a can of Crisco, but that's the way they cook their fried chicken. So we just have to change those things, and it's through education and making the effort to find alternative ways to be healthy.
Right. And that's some of the things that we do in our extension classes. Definitely we do. One of my favorite projects is our mobile cooking school, where we do cooking classes for folks, and we actually teach them safe, economical, nutritious, easy meals, reduce the amount of sugar, fat, junk food that they're eating. Hopefully, encourage them to go through the drive-through less often, and just to eat more healthfully, so that the long-term benefits. And the thing about food, nutrition, and health, you didn't get that way overnight. It's not going to change overnight. It really is. It does take effort. But it can happen. And I like what you said too about it doesn't have to be set in stone just because of genetics. And those statistics that I gave earlier, genetics really only make up about 21% of what affects your health. So that means you have 79% chance to not get a chronic disease. And there's so many ways that you can address that. So good physical activity. Which Walk Across Texas, mentioned that.
Yes, Walk Across Texas is coming up, and we're gearing up to get our teams together. And at Lone Star, we get very competitive. We have different departments and different teams. So people are already starting to walk. So they hear about it and they're ready. In fact, last year we started some very good habits with our teams starting to walk, and they're still walking because they developed those habits last year with Walk Across Texas. Yeah,
and that fun, friendly competition among people is one of those catalysts that kind of help us get going. And then the hopefully the result is you've been walking for 8 weeks. Let's just keep on walking, and and that physical activity and that is going to help reduce the chances of getting one of those chronic diseases. So it's going to make a huge difference. Walk Across Texas is an 8-week program, 8 weeks. We encourage people to get into teams of 8 and collectively, not simultaneously, but together, by doing different types of physical activity, walking or other things that kind of get your heart rate up, break a little bit of a sweat, about 20 minutes or so. That's going to equal a mile. Add up all of those miles. Try to do what you can to walk 833 miles across Texas. And so
that's right. Time in the gym counts. Working in your yard, mowing your yard. Those things count too.
Oh yeah. And even at the office, going up and down the stairs. You go into the grocery store, parking further back in the parking lot. All of those are good little tricks to add up those steps. 8 weeks, 833 miles, 8 people on a team. You can have less than 8. We don't want you to have more than 8. So you can you do it online. So you have someone who's going to be your team captain, and then even a site. So like at Lone Star Family Health Center, maybe there's someone there's one person who kind of coordinates all of the teams, and they kind of keep track of who's winning.
Right. We actually every week we turn in our miles, and they add them up, and then they post every week which team has the most steps or who has walked the furthest. So then everybody gets competitive and wants to beat that team. So it really keeps things going and keeps it fun and exciting.
So we want as many people as possible doing that in Montgomery County. Anytime, you can actually do it anytime, but we have a big push for it, the Montgomery County Community Challenge, and that starts April 1st, on or around April 1st for some folks. That's not, I think it's maybe a Thursday this year, so may not be the best time to start, but if you started that next Monday, it's fine. So for those 8 weeks, and the team captains add up the miles, and we create really good, healthy habits. And so I'm going to close that now, and because it's time to take another little break. But we'll come back and we're going to talk about a few more things that we can do for our health. You're listening to the Extension Hour right here on Lone Star Internet Radio.
You are listening to the Extension Hour on irlonestar.com.
I'm Lieutenant Bob Berry with the Conroe Police Department, reminding you that drinking and driving do not mix. Drinking and driving causes an alcohol-related fatality every hour in the United States. Stay sober and stay alive.
Hey, this is Cindy Cochran, and now Conroe can boast of another first. The first morning live talk show, 10 to 11 a.m. Monday through Friday, right here on Lone Star Internet Radio, coming straight out of the fabulous downtown Conroe, Texas. Be the coolest guy at the water cooler, or the most informed break room dweller by listening to the fun side of the news, local, national, infinity, and beyond. The Cindy Cochran Show. You ain't heard nothing yet.
Hello, Montgomery County. I'm Rachel Baldwin with Special Olympics Texas, Area 6. Are you a fan of courage? Are you a fan of determination? Are you a fan of acceptance, grace, and skill? Then you're already a fan of Special Olympics. Make it official. Volunteer, coach, and/or compete and be a fan of dignity and acceptance. The dedication of our Special Olympics Texas volunteers provides mainstreaming experiences for athletes with intellectual disabilities. You will touch the heart of another person, and it will move you in a meaningful way that lifts the spirit. Please visit the Heart of East Texas Area 6 webpage at www.sotx.org. Also, like us on Facebook to be a fan and be part of Special Olympics Texas.
You are listening to the Extension Hour on irlonestar.com.
Welcome back. This is Amy Ressler, County Extension Agent for Family and Consumer Sciences. I've got Marilyn Kasmeirsky with me. So glad you could join me this afternoon, Marilyn. We've been talking about health issues and things that common chronic diseases and things we can do about it. And we've also talked a lot about the health clinic. Tell us, though, a little bit more about what you do at the clinic, at the health center.
Well, actually, I was business development director for 6 years, and now I'm in the role of a professional in government relations. And basically, we try to get out and just keep those connections with the community and with the physicians about the services that we provide, and also to educate legislation on the things that we are doing and how important it is to support the issues that have to do with health care for families in Texas.
Great. That's such an important role there. Because when we think about health centers, we think about just, the doctors that are there, but there's so much support that goes into that as well. So it's great to have you.
Thank you.
So let's talk a little bit. So you and I are both women. Let's talk about symptoms. Some of the things that women experience. Maybe we'll just focus on that a little bit. And one of the things that this is February, Heart Health Month. We think about hearts and Valentine's and that kind of thing. But, let's talk about taking care of our hearts. So interestingly that the symptoms of heart attack and stroke in women are a little different than men.
Yes, they are.
So some of the things to look for, there's one of the symptoms is an unusually heavy pressure on the chest. It feels like there's just a ton of weight. So most heart attacks do involve chest pain and discomfort in the center or the left side of the chest. Heart's on the left side, so makes sense. It usually lasts for more than just a few minutes. You may have for whatever reason, there's a variety of reasons why you might feel that heaviness, but if it lasts for more than a few minutes or goes away and then comes back, or it can feel like a really uncomfortable pressure, squeezing, fullness, pain, and interestingly, it may actually even feel like heartburn or indigestion. Which
a lot of people do sometimes just think it is indigestion and it is a heart attack. But women, it can be even a little bit different. It can even be in your jaw. It could be a jaw pain. You could think it was a muscle in your jaw or something that has to do with dental, but it can go from your jaw all the way down to your heart or even in your shoulder. You know, it can have not just the numbness in your left arm, but it can be go up to the jaw. And so the symptoms are not always the same for everyone. And so the best thing to do is to always get checked and to go to the ER. Well, if you think you're having a heart attack, the best thing to do is not go to the doctor's office or go to an after-hours clinic, but go directly to the ER so you can be assessed.
So the family health clinic is not an ER. You have after-hours appointments available, so people can just walk in after hours. But
we do have walk-in after hours Monday through Friday from 5 to 9 p.m. and Saturday 9 to 1. And that is for just, your regular illness. If you have an ear infection, sinus infection, the flu, that type of thing. But anytime you're having chest pain or feel like you're having a stroke, something like that, you need to go to the ER.
And, my philosophy is better safe than sorry.
Absolutely.
And I guess women, I don't know, men are stubborn too, but, sometimes we think, well, we don't want to, we're the caregivers, and so we don't want people caring for us. And just recently my mom actually had a big scare. We thought she was having a heart attack. Fortunately, it turns out it was not, but she was having a lot of these symptoms that we're talking about, and I am so thankful that she went ahead and went to the hospital. I mean, they called the ambulance and they took her in, but I'm just so thankful that she went, because you never know, and it's better to know than.
And you can even feel clammy or have shortness of breath or even a little bit of dizziness or lightheadedness. There's all kinds of different symptoms that can be affected when you're having an issue with your heart.
Sure, yeah. And so cold sweats, clamminess you mentioned, but if there could be other reasons like menopause, but if you know that it's not menopause, that it's unexplained or excessive, then definitely you want to get that checked out. Or unusual, unexplained fatigue, tiredness.
Yes.
We get tired for good reason, but if it's continuing and you just feel really, really, really tired, unfamiliar dizziness or lightheadedness is another thing. Unexplained nausea, feeling sick to your stomach suddenly, or vomiting. And when all of these things are happening together, that's definitely something that you want to get checked out.
And you can even tell your doctor that you're having these symptoms, and they can schedule a screening and give you some tests or an EKG to make sure and have you checked out to see if there is an issue with your heart or there is a blockage.
Right, and even if it's not a heart attack at that moment, they could find that there are some other issues that are affecting you. So if you think that someone near you may be having a stroke, you can act fast and do this simple test. And so FAST, we can remember that as an acronym, FAST. And F stands for face. So you face the person, ask the person to smile. And does one side of their face droop? Then that may mean something's not right. A is for arms. You ask the person to raise both arms. And if one arm drifts downward, that cannot be another indication that something's wrong. Speech, you can ask the person, S is for speech, ask the person to repeat a simple phrase. Is it slurred or is it strange? And then T is for time. If you observe any of these signs, then it's time to call 911 immediately. So definitely you want to think fast.
And don't be afraid to call 911. I know that we've had situations we think, should we call, should we not call? It's always better to call 911 and be safe rather than sorry.
Yes, most definitely. So we're talking about women's health, and I know the health center has a lot of women's health programs. You guys have full obstetrics and gynecology, right?
Yes, we do. We have 2 OB-GYNs on staff. We have a male and a female. We have Dr. Gordon and Dr. Nichols. And then we have 4 of our family medicine doctors also still deliver babies. Oh. So even our CEO, Dr. McKernan still delivers babies as well as being the CEO and running the family medicine residency. So he's very, very busy. But absolutely. And we can do the surgeries. We can do hysterectomies, and we can do different things like that. So whatever the women's health issues are that needs to have assistance, then we do have the women's health providers to take care of that.
Okay, and so those surgeries, are those on site?
No, they would be at the hospital.
Okay.
We do have preventative things that we can do, procedures that we can do in the clinic, but for surgeries, we do go to the hospital.
Good to know. So we're also talking about women's health. Lone Star Family Health Center has been doing for the last 3 years the See, Test, and Treat.
Yes, we have.
Tell us more about that, because there may be someone listening thinking, I really would like, I need to I need to go in for my annual exam, but I can't afford it, don't have the insurance. We have resources, right?
We are so excited with the CAP Foundation. There is a See, Test, and Treat program, and it's through a grant through the CAP Foundation, and also we use our mammogram Komen money, and CPRIT will be involved this year, and we even had Montgomery County United Way and some community partners contribute. But we do free well woman exams. We do the pap smear as well as the breast exam, the mammogram. We not only see you that day, but if you have an abnormality, we will treat you. So we see you. You do the testing, you wait for the pathology, and then we will do the preventative procedure that is necessary for the women. We actually make it fun. We have a day where it's sort of like a health fair, and there's a lot of education and activities. All the families come. We have children, somebody to watch the children while the mothers are getting seen by the doctor. We have education upstairs. AgriLife is always a big part of that. And a lot of the different things that you do, the healthy cooking. And so it is going to be in October. I believe this year it's going to be October 20th. The only criteria is there's no insurance. You do have to have an appointment, and we will start taking appointments later on. But we haven't opened that up yet, but we will again in the fall. And we're so excited to be able to bring that to the women. We have usually screen about 120 women or a few more every year. We have had some findings. We've had even oral cancer findings, but we have had some breast cancer findings and also some start of cervical cancer. So with this, we could actually get the woman taken care of immediately where it would save her life. So we think that's huge. It's huge. It's a huge gift to our community, and all the Lone Star staff and doctors, nurses, we all volunteer our time that day to provide this service to our community.
That is so awesome. And it just, screening, you've mentioned it before, it makes a big, big difference.
Absolutely.
Sometimes people are afraid to go do that because they're afraid of what they might find. But the truth is, you find it early, it's much, much easier to treat and move on than if you wait too long and let it get out of control.
And we have, we give away a gift, and we do a passport system, so they have to go to all the different educational booths. But one lady told us she hadn't had a well woman exam in 10 years, and even though she won an iPad because it was donated, she said the best gift she got that day was a clean bill of health. She was so worried that there was going to be a finding because she hasn't seen a doctor in 10 years. That's pretty powerful.
That is. So, and tell me again, though, is there an age requirement?
For the pap smear, it's 21 to 64, and for the mammogram, it's 40 to 64.
Okay. And that's women who do not currently have insurance.
Correct.
So it's a good opportunity to have that looked at, taken care of.
That's exactly right. No insurance is the only criteria.
Okay. So we've been talking with Marilyn Kasmeirsky, the Director of Professional and Government Relations, but you just do so much more. You're such a good representative for the Lone Star Family Health Clinic. And so we're talking about health and things that you can do, and we're just kind of like talking about all kinds of things. And so we've got a few more things that we want to talk about. We got to take a break, and we're going to come back. But this is Amy Ressler, County Extension Agent for Family and Consumer Sciences, and you're listening to the Extension Hour right here on Lone Star Internet Radio.
You're listening to the Extension Hour on Lone Star Internet Radio every Friday afternoon at 1 p.m.
Our community's animal shelters cannot absorb accidental litters of kittens and puppies. Approximately 80% of the animals entering our shelters will not make it out alive. Please help be a part of the solution. Please spay and neuter your pets. Many low-cost options are available. Visit TexasLitterControl.org to learn more. That's TexasLitterControl.org. And remember, real Texans don't litter. Please spay and neuter your pets.
SPCA PetSnap of Montgomery County is a 501c3 all-volunteer-based rescue and adoption organization with a no-kill policy for healthy and adoptable animals. Our goals are fourfold: to rescue and rehabilitate homeless animals, to provide a safe haven for the animals until a suitable adoption or foster care home is found or until they are reunited with their owner, to educate the public about the great need to reduce pet population, which includes the importance of having their pets spayed and neutered, and to further the cause for humane and responsible pet ownership, and to provide a low-cost spay-neuter clinic for people who are unable to afford to spay or neuter their pets otherwise. SPCA PetSnap of Montgomery County encourages you to think adoption first. You can contact us at www.spcaofmc.com.
Howdy, howdy, folks. Cable Smith, host of the Lone Star Outdoors Show, inviting you to join me Saturday mornings from 7 to 8 on Lone Star Internet Radio for Texas' premier hunting, fishing, and outdoor talk show. So pour yourself another cup of coffee and pull up that stool a little closer to the old campfire, because if you can catch it or kill it in Texas, we're going to talk about it. That's right. Bucks and ducks, gobblers, monster bass, redfish, trout, and a whole lot more. Plus, you never know what outdoor celebrity is going to drop by, from Phil the Duck Commander Robertson to fishing legend Bill Dance or everybody's favorite uncle Ted Nugent. Heck, we might even mix in an interview and hear some brand spanking new Texas music from one of your favorite Texas musicians like Robert Earl Keen, Brandon Ryder, or the honky-tonk kid himself, Aaron Watson. Loved or hated but never ignored, it's the Lone Star Outdoors Show with me, Cable Smith, Saturday mornings from 7 to 8 right here on Lone Star Internet Radio on irlonestar.com.
Have a legal question? Are you a resident of Montgomery County? Call 281-645-6344 to talk to a volunteer attorney from the Woodlands Bar Association. We answer the phones on the first Monday of every month at 281-645-6344 from 5 p.m. to 8 p.m. to provide general legal information and information about legal resources to Montgomery County residents.
You are listening to the Extension Hour on irlonestar.com.
And welcome back. Good afternoon. This is Amy Ressler. I'm County Extension Agent for Family and Consumer Sciences. We've got Marilyn Kasmeirsky with us. And Marilyn is with the Lone Star Family Health Center. And they do such great things there. I'm so glad that you could be here with us today and talk about some of your exciting things happening. We've talked about the See, Test, and Treat. It's going to happen in October, which is Breast Cancer Awareness Month. So that's a really good time to have it. So that's a good thing for people to remember. And it's later in October. We think it's October 20th, but it's possible it could be a different date. But as time gets closer, they'll start taking some appointments. So just keep that in mind as October rolls around. And then just lots of other services that are always available at the health center. But you were telling me about this great project that you guys have coming up. It's a healing garden.
Well, we are really excited. This is very state-of-the-art, but, we want to be a health center for families and a place where families want to come. And a couple of years ago, we had a program through Friends of the Forest to write prescriptions to get families outdoors, to get children off of the technology and get them outside as a family for health and wellness. And then that funding went away, and the funding came available before the Arbor Day Foundation and Nature Explore program, and we were offered the opportunity to write a letter of intent for that grant. And we're so excited. This even goes all the way up to Washington, D.C., and the U.S. Forest Service that's there. And we got the grant, and so we are in the process of having amazing collaboration and partnerships with all over our community and resources to have a Nature Explore classroom. So we have AgriLife. Actually, it's Texas A&M Forest Service. AgriLife Extension is going to even be participating in it. And we are going to be building this area where families can go and be outdoors. A lot of research has been done on this. There has been studies done where people heal better if they're outside, mentally and physically.
Sure.
It's great for children with ADHD or autism to be outside. There's been a whole lot of research and development done around this. So we're going to have a music area. We're going to have a free running around area with a little hill for the children to run on. There's going to be a messy area where they can play with tree cookies and actually touch nature and build things with, sticks and little cookies made out of trees.
Yeah.
And there's going to be we're going to have some bedding areas where we can actually have them plant some herbs or some things that are easy. Native trees are going to be donated, so we're so excited about that. John Warner at the A&M Forest Service has been amazing putting those partners together for us. So we're so excited. It's going to be a place for the community to come. And like I said, we're going to have a recreation area, a planting area. We're even having some dancing scarves where people can run around with their scarves and let them play. It's just going to be really good. Our counselors are excited. The benches are going to be made out of tree logs. It's going to be very nature friendly. Everything's going to be natural.
Right. And, I'm listening to you describe all this and I think, that sounds so innovative and so forward thinking. But, at the same time, it's one of those, maybe we used to go outside a lot more, but our society has changed so much that it's great to be able to offer that and to connect it with health and healing is just, it makes so much sense to do.
We're excited. We're hoping to have it complete just in time for Arbor Day. So we hope to have a ribbon cutting, which is the last Friday in April. And it's just been great to see all the different partners that come to the table. We have an Eagle Scout that even wants to come and build it for us, put the different equipment together for us and things like that, and the signage, which is huge because it's also bringing education and awareness to all ages, the youth and the Eagle Scouts, as well as, the adults, not only the medical community, but the whole community.
Yeah. So wait, now where is this going to actually be located at?
It's going to be at our Conroe Health Center. It'll be on the west side of the building. We have a little grassy area there, and so we're going to be transforming that grassy area that's got the landscaping to actually our Nature Explorer, and we're going to be replacing some of the trees with some native trees and plants, and it's going to be beautiful. We had an architect come that actually the Arbor Day Foundation, he actually designs these spaces specifically for this reason and for healing. And all of the equipment has actually been tested for tone, so it's not offensive to children with disabilities or others. It's actually sensitive where it's healing to them. So we're really excited. It's going to be an area where a lot of people will be able to go and just enjoy and not be afraid to go out and be in nature and play.
Sure. How much space are we talking about?
It's not really large. We don't have a large space to put it in, but we're going to utilize the space very well.
Great. Just getting outside and doing things. I'm almost speechless here, because I do think that's just really, like I said, so innovative and such a great idea. Connecting people with nature. I guess there's some of us that work in agriculture-related fields, and we think in terms of nature and health and wellness, and it just makes sense to us. But I know for some people, it's not not natural. It's not something that they think about right away. But so what I'm thinking to myself now. So if the health center is doing that, if that's something that that doctors and researchers and scientists are saying this is something that can help heal people, I think that there's things that we can do at home,
right,
to kind of heal ourselves as well. And I've mentioned this in the first couple of segments, but ideally people would only go to the health center for really serious issues, and if they can find ways to prevent those chronic health issues from happening to them, that's going to make a huge difference in their own quality of life. And it's great to have the health center there when people need it, but it's also great to kind of avoid it if you can. So I wanted to talk in our last few minutes just a little bit about making some changes. So small changes really can make a very big difference. And we talked a lot about lifestyle choices, and those really have the very best potential to improve your health and reduce those costs that are involved. And so getting outside obviously is one thing. Stop tobacco use is another big thing. Do you guys have anything that's helping that helps smoking cessation?
Well,
Cessation, not sensation.
Our doctors actually do work with the patients individually, but there are different classes and things that people can go to help them prevent smoking or to get to stop smoking. But our doctors do work with the patients individually.
Okay,
that can prevent so many diseases if people just stop tobacco use.
Oh yeah, and it's easy to say just stop smoking, particularly if you don't smoke to begin with. But if you're a smoker, to just say just stop. That's kind of hard. So it's
addictive. It's like cocaine. I mean, nicotine is a very addictive drug.
Yeah, and it's okay to ask for help. Some other things you can do: physical activity, just getting more exercise. 30 minutes per day on most days in a week is going to make a big difference. We talked about Walk Across Texas starting in April 1st. We want to have lots and lots of teams here in Montgomery County. We want to make Montgomery County more healthier, and proper nutrition. Another small change that can make a big difference. Lean meats, fish, fruits, vegetables, whole grains. It's actually that easy. Hydration is important, moderate alcohol use, and then things like adequate sleep, managing stress, wearing your seat belts, all those things. Small changes, big difference. And change is hard, but you ask yourself, do I need this? Is it even good for me? What would happen if I didn't have this? And is there a better way to spend my money on food, things, stuff? And and if your answer to all these is no, then do you still want it, and why? And health is such an important thing. And I wish I could remember the exact quote, but we spend our lifetime spending money to be happy, and then we have to, if we're not healthy, then we end up spending a lot of money trying to get healthy. So we want you to be healthy. Take advantage of educational opportunities like those that we have at the Extension Service and at the Health Center, and go to the Health Center when you need it. So thanks for joining us this afternoon. This is Amy Ressler, County Extension Agent for Family Consumer Sciences, right here on Lone Star Internet Radio.
Thank you for checking out a podcast on Lone Star Internet Radio. Lone Star Internet Radio is Montgomery County's community radio station, broadcasting from the heart of Conroe, Texas. If you are interested in sponsoring a program for Lone Star Internet Radio, just visit us online at irlonestar.com or message us on Facebook. We are always taking song requests on Twitter, and if you are interested in getting involved with the station, by either hosting your own show or if you want to be a DJ, just contact Dick at irlonestar.com. Lone Star Internet Radio, Montgomery County's community radio station.